Apologies. All right, so as they're doing so, we've assembled a panel today, and I will be moderating the panel. And one of the things that we talked about as we assembled today's group is that so often lately we've been having a conversation about the pandemic, talking, and I've noted Dr. Sisson as a great example here, is that when you see Dr. Sisson in the room, you immediately start thinking that we're going to get an update on COVID. Today's conversation was meant to be really a conversation about where we go after the pandemic. And I know that we're still dealing with a lot of impacts and effects from that, but today's conversation is about, how do we build a stronger Yolo County? How do we continue to move forward as a county? What steps can we take and what measures can we take? And you can see we've assembled a cross-agency panel here. We've got some medical experts, we got some folks that are working in nonprofit organizations, and we're really hoping that this helps inform where we go and builds on the conversations that we had today. So I wanted to start by introducing our panelists. So I'll start with Jeneba here in the middle. Jeneba is the executive, did you say? Oh. Jeneba is the executive director of the Yolo County Children's Alliance, and so we're asking all of our panelists to go ahead and introduce themselves, but they would also share a little about their agency and their introduction as well, and also what brings them to Yolo County.
Thank you very much. Good afternoon, everyone. My name is Jeneba Lahai. I'm the Executive Director of Yolo County Children's Alliance. We are the Child Abuse Prevention Council of Yolo County, and we've been around for 20 years, mostly working on coalition building surrounding child abuse prevention efforts within the county, and then we evolved into programmatic support for families. So that's a brief, very, very brief description of my organization and what we do. It just feels like our fingers are in everything in Yolo County as it pertains to children and families. But for my own personal journey to Yolo County, I'm an immigrant from Sierra Leone, a refugee. So we all know what's happening in the world right now. If you have friends who are immigrants or refugees, it's very triggering for them. And most of us have gone through some form of trauma as it relates to unrest worldwide. And that's how I ended up in the United States as a child. When you say resiliency, I feel like I'm the poster child for that in some ways. As a child, I went through a civil war at the age of 7 in Liberia, which is in West Africa. And then, was a refugee for a while. My uncle then found us, lived in a French-speaking country, went to French school, elementary school, and then came to the United States to live with my dad. And that's how I ended up in the area, went to Sac State. Of course, when you go through an experience like that, you end up working in a humanitarian field. And that basically shifted my worldview. I've always, after going through such an experience, I've always wanted to work in the humanitarian field because, you remember the people that helped you along the way. And in some way, you're healing your trauma through that process of helping other people. Gosh, I'm going deep. So, did the whole AmeriCorps thing, worked in the Birth and Beyond family resource systems in the Sacramento County, and then ended up at Yolo County Children's Alliance. Built the Family Resource Center up, added programs, support programs, and then eventually when our founding director retired, I was asked to step up as the executive director. I think I am the only Black nonprofit executive director in Yolo County. I'm very proud of that. So, thank you.
Great, thank you for that.
Obviously, I don't know how to handle a mic. Okay. Are you sure?
All right, sorry. There's a third mic that's temperamental, and I must have picked the wrong one. All right, so with that, we are very pleased to welcome Dr. Ashley Sens. She has been on staff as a pediatrician with Woodland Memorial Hospital since 2014 and has served as Chief Medical Officer for Woodland Memorial Hospital since July 2021. She has also served as the Chief Medical Officer for Woodland Clinical Medical Group as well from February to May of 2022. And I would like to invite her as well. The question again is, if you would just share your role in the county, but also again, what attaches you to your work in Yolo County?
Thank you. I felt really tired when you listed off all that stuff. So it's like, no wonder I'm so tired all the time. But I am so privileged to be able to be here in Yolo County and work as a pediatrician. I love being a pediatrician, and I also love being a chief medical officer. Really, I think of my job as kind of taking care of the doctors and nurses and really making sure that we're advancing quality and safety for all of our patients. And as far as being in Yolo County, I intentionally live where I work because for me, it's about serving my community. And I can tell you during these past 2 years, there were many days when I would drive home from the hospital and just feel overwhelmed and exhausted. And I would intentionally get to the stop sign or the red light and look at the people in the car, look at the mom driving, look at the kid in the back seat in a car seat, and I would just remind myself, everything we're doing is for them, or everything we're doing is for that person's grandma, because that's the community where I'm working, and it makes the work have meaning. And I will never, ever work somewhere where I don't live.
All right, perfect. I tested the second mic and we're not getting echo. And I would just add to that, there were a lot of nods as well, that we're all making a distinguished choice, that Yolo County is a great place to be, so. All right, with that, I would like to introduce Dr. Tico Zendejas. In our pre-interview, he wanted to clarify that he is not a medical doctor. There are two on the panel, but he is the one that is not. But he is the executive director for RISE, Inc. He has been in youth development and social services for over 2 decades. RISE is a public nonprofit organization that provides a variety of social services to the communities in the western rural Yolo County. So please join me in welcoming Dr. Zendejas.
Thank you very much. Thank you, Anthony, to Ms. Tessa, to everyone that put together this amazing event. Happy to be here in person. Thank you all for staying till the end. That's awesome. And for those that are watching on Zoom, I appreciate you being here. So my name's Tico. I'm here in Yolo County. This is home, born and raised, and attended public schools here, specifically in Woodland. So for me, it was about service and wanting to give back to the community that raised me and the supports and opportunities that we needed to advance. So my family are immigrants that came from Mexico, and we're in search of the American dream, and here we are. And education for me has been my ticket to new opportunities, and it's something that I'm really passionate about. And I serve on the county office school board, previously on the Woodland School District. And why I continue to be here again, because this is home, right? We have options to go and serve other places, but for me, the other option, this is it for me. So I work out in the rural areas of Esparto, Madison, Cape Valley, City of Winters, and we also RISE provides youth services here in Woodland. And the last couple of years have been rough, right? As folks here have been mentioning, and our team has been absolute heroes. All of you working in this field and being advocates for your community over the last couple of years are heroes. Our families, our children, our seniors, they really needed us, and we kept going during the last 2 years and served. And I'm extremely proud of my team out in RISE to be able to step up during the last couple of years and model resiliency, right? And so that's why I'm really happy to be here, because it's all about partnerships, it's all about building relationships and learning and sharing the information that is available so that we can get that information and services to those that need it the most, right? So that's the key thing. We want to build that trust and relationships in our communities so that folks not only know about our services, but they can access those services and they feel safe doing so. So happy to be here, and again, thank you.
Thank you. All right, last but not least, we have Dr. Aimee Sisson. She has served as Yolo County's health officer since October of 2020. Prior to being appointed as Yolo County's health officer, she served in various capacities at the California Department of Public Health for over 10 years. She also has received a Master's of Public Health and Epidemiology from UC Davis, go Eggs, and a Doctor of Medicine degree from the University of California, Los Angeles. And so to you as well, Dr. Sisson, I know you're the newest, I believe, on the panel to Yolo County, but what brings you to Yolo County? What attaches you to your work here?
Yeah, thanks, Anthony, and hopefully you can hear me okay. I am going to keep my mask on today because I hear that the Yolo County Health Officer has recommended that people wear masks indoors, and I like to follow my own recommendations. So apologize for the muffling, but appreciate the opportunity to be here on the panel, appreciate the opportunity to serve as Yolo County's health officer. A lot of you know me from my work with COVID, and unfortunately that's really been all I've been able to do since I've been here as health officer. But the role of health officer is larger than just treating one infectious disease. The role of the health officer is to protect and the health and prevent disease for all residents and people in Yolo County. So it's a very broad charge. And I'm grateful to be here today, and hopefully sometime in the near future we'll be seeing our cases coming down so we can focus on things other than the pandemic and recovery and resilience. In terms of my connection to Yolo County, I went to junior high and high school right down the road in Solano County, but in Vacaville, so very, very close. And as Anthony mentioned, I got my master's in public health at UC Davis. But one of the reasons why I came to Yolo County during the pandemic was because it was a great opportunity to work in a county where I had farmed, actually. Sort of an offshoot of my public health career is that I ran a small farm in West Sacramento, across the street from an elementary school for a couple of years. So I literally had roots in Yolo County. And I also have family members who live in Yolo County. So when I'm making decisions as the Yolo County health officer, I'm thinking about my family and all the other families in Yolo County, and making decisions for my own family. So thank you.
Thank you. And again, I would just add, in sharing all of that, thank you again as well. This is a Yolo County Leaders panel. We do really admire all of your work as Yolo County leaders, especially through this pandemic. All right, so as we kind of ground this conversation, we did that this morning too. You can cue up the next slide. We wanted to share some definitions. And so this morning we had a great introduction from Tracy Farber from CASA about ACE's work. She talked, I don't know if she said toxic stress. Did she say toxic stress? This is a definition that we wanted to put out on the page today, especially as we're, again, talking about the pandemic and its impacts. So toxic stress represents long-term change to the physiological stress response system resulting from severe, intense, or prolonged adversity. But what is resilience? So resilience can be described as a varied and dynamic mix of many traits like determination, toughness, optimism, faith, positivity, and hope that allow an individual to have an ability to bounce back from life's difficulties. So perhaps I could maybe start with like Tico and Jeneba. So in hearing this definition of toxic stress, what stands out for you as it relates to the communities that we serve? Where do we see stress and trauma impacts from this pandemic?
It's a great question. So I think we see it every day in our parents and our families that are making it, that are surviving and trying to thrive during this time of uncertainty. The ability to keep going and moving forward and asking for help when they needed it. The last couple of years, we've seen a lot of new families that we didn't realize that were in our community because they weren't entering through our doors in need of services. And I think that's a real clear indication of where it's been the last couple of years and resiliency, right? Being able to put yourself out there and access these services when you need it most so that you and your family can bounce back. So we see it daily. We see it daily with our youngsters, with our students, with our preschoolers, right? The ability to come and learn and be happy and put that smile on, even though we can't see it under the mask. We knew it was there, and we were giving it to them as well. So every day we see examples of resiliency, and things like this that bring us together is what will continue to move us into the future.
Yeah. Tico is my counterpart in the rural area, and since the beginning of the pandemic, we've all been working day in and out, supporting the county in the COVID-19 response work. One of the things that we realized in the nonprofit sector is that we were not categorized as essential workforce, but we are essential workforce. We're the ones holding that space for families. And our workforce went through a lot. I know you previously had a presentation by the community care team about burnout and toxic stress. Everything that you heard during that presentation is also something that the nonprofit sector experienced. So for my organization, we have one of the largest comprehensive home visitation programs in the county. We have a family resource center in West Sacramento. Dr. Sisson here used to hang out with us when she was a farmer back in the days. And we also have services like, employment services, youth employment services. Eric is here representing that today. So we have many, many services throughout the county. And what we've seen throughout this whole process is people who were teetering on the brink of poverty or working multiple jobs. And, inequity existed prior to the pandemic, and because of the pandemic, that gap has widened. When Tico said new families are coming into the system, it is real. I was just told by my Family Resource Center manager that our weekly food distribution at the Family Resource Center in West Sac is now seeing 400 people a week for our food distribution program. So you have to really think about, what it means to be in poverty and experiencing that stress on a daily basis, trying to figure out, how can I pay my rent when rent keep increasing? How can I pay for this? My partner has to stay home and take care of the kids. We used to have a 2-income household. Now we only have a 1-income household. So I believe Tico and I really see that on a day-to-day basis, and we try our best to support communities. But in the nonprofit sector, a lot of the time, something that we need to be mindful of too is that basic needs are not funded. So, we're having to really, as an organization, work with our partners and work collaboratively with partners in Yolo County to make sure that basic needs are being met. Okay.
So let's go ahead and move to the next slide. We wanted to use this as a place to go ahead and introduce the ACEs concept. So as we learned this morning, ACEs are adverse childhood experiences. They come from a landmark 1998 study from the CDC and Kaiser Permanente, and they describe 10 categories of adversities in 3 domains experienced by the age of 18 that include abuse, neglect, household dysfunction. And that's a very short definition. We went a lot deeper this morning. And I guess I would ask Dr. Sens first. So we heard the impacts from Jeneba and Tico. Are we seeing those as well play out in the medical setting as you're seeing families? What are we hearing on the field?
The answer is absolutely yes, across the board. And I'd like to take a moment and just share with all of you a story. And this really speaks to resilience. And it also speaks to the role that each one of us as individuals has and the impact that everyone can have. Dr. Suzanne Edson-Tan was speaking earlier today. And for those of you that were here, she was talking about Rachel Naomi Ross's the stonecutters kind of analogy or allegory. And really it's a story about finding meaning. And I think for resilience, it's really key for us to be able to stay grounded in the meaning of our work And that was really hard for a lot of us to do, I think, through the pandemic, to keep a sight of that. And I wanted to share with you a moment that really taught me about that the idea of meaning and resilience, and that is in the hospital. The frontline workers, of course, couldn't work from home. Those essential employees, whether they're working in the grocery industry, agriculture, and then of course the hospital setting. And at our hospital, we do these leadership rounds, and we go around and we talk to just everybody who's working, and hey, how's it going today, right? And this story came to me from one of our leaders who was rounding and stopped and spoke to one of our environmental care workers, someone who's working essentially to help keep the hospital clean. But she didn't define her job that way. What she said was that my job is to prevent patients here from getting infections. And that was the meaning of her work. And she was one of those people that has to go into the COVID rooms and clean up after a patient is discharged to home, hopefully, or maybe passes away. And for her, it wasn't about mopping the floor. It wasn't about emptying the trash can. It was about creating a safe environment for the next patient so that they wouldn't get an infection, which is really, really key. And that story was relayed to me, and I just thought to myself, that is so key that she has that understanding of the value of the work that she's doing, and that every day she can show up and do that. And in that moment, she was a teacher and a leader. And I just wanted to share that with all of you.
Well, I think that moves us right into the deep dive into the topics. And I think, when we met with Dr. Sisson earlier this week, we talked about the COVID pandemic has had such a dramatic impact on the medical community. So today we've heard a lot of presentations about mental health and wellness, for medical providers. But how do we start to build resilience in our medical workforce by healing individuals from the trauma of the pandemic? Can we start with you, Dr. Sisson?
Sure. I mean, I think the first step, and Suzanne Edson-Ton mentioned this earlier, is just to acknowledge the reality of what our healthcare and our public health workforce has been through, and to validate that experience. I think, it has somewhat been dismissed because we've been so busy and focused on the work, but to just pause and acknowledge what a challenge we've all taken on and experienced. And this is true for the entire population, but speaking specifically about the workforce. And I think we need to give individuals permission to not be okay, to accept that we've been through a really challenging experience, and it's hard, and it's okay to be feeling that. It's okay to have less motivation than you did before and to be experiencing burnout. We need to address that, but we need to allow people the permission to feel what they're feeling. I think we also need to acknowledge and celebrate their successes, their dedication, their resilience, their achievements over the last 2 years during the pandemic. And then we need to provide support to staff for their well-being. And as Dr. Sens mentioned, those leadership rounds for to be present with our frontline staff, to hear about their experience, I think is really important. And then to make sure that as we're doing well-being, supporting their well-being, that we're providing spaces that are psychologically safe, where people feel comfortable being vulnerable and sharing their experiences, but also opportunities to share humor and laughter, which are really important for healing. This doesn't have to be about, serious debriefing, although that's important, but we also just need to learn to have fun together again and to reconnect in person. And then I think it's important to get input from staff themselves on those leadership rounds and other opportunities for how we can learn from this really disruptive experience so that we can not just bounce back, but bounce forward, and these opportunities for post-traumatic growth. And I'm sure we'll have an opportunity to say more about that as this panel goes on. But I think those are the key points for me as we're looking at our workforce.
Dr. Sens, did you want to add to that? I know we got a chance earlier to hear what CommuniCares is doing and some of that as well trauma impacted on their workforce and the things they're doing. Is there anything that Dignity Health is doing?
Well, I actually I received this question ahead of time, and it's such an important question. So thank you for asking it. I actually would like to ask your permission that instead of having me answer this question, I would like to use this time to allow one of our nurse leaders to have a voice and share with you the impact of this trauma that she has seen firsthand. So may I share this with you? So her name is Celeste Santoni, and she is one of our nurse leaders. She is the nurse manager in our ICU at Dignity Woodland Memorial Hospital. And she said, "To be honest, I am not sure there is a good answer in how to deal or heal from the trauma. Many of the staff are so traumatized that they have just needed a change, be it moving to another unit, going from full to part-time or part-time to per diem, or leaving this as a second job. This is all so that they can gain better balance in their lives as they recognize those important things that fill them up in a way from the place that caused the trauma. Supporting their transitions is the only way that I have found to be beneficial to staff. There is so much research and so many recommendations out there for mindfulness and check-ins and employee assistance programs, among a number of other things, none of which has true significant impact on staff. The pandemic threw us all out of our normal balance, and for some, an adjustment to gain that balance back is the only thing that has helped." I wanted to share this with you because what really struck me about her answer was, first of all, how just gut-wrenchingly honest it is, right? Just that permission that you're talking about, the permission to say we're not okay, right? The other thing that struck me is her leadership skill to be there for her staff in the way that they needed her, right? She doesn't see her job as fixing them so that they can stay at the bedside. She sees her job as taking care of them, even if that means moving on. And I'm just so grateful for her.
Yeah, I would just add, I think we're all grateful. I think we acknowledge, frontline workers was a term that kind of came through the pandemic, but there's a different definition of frontline, and I think Jeneba and Tico wanted to speak to that a little bit too. I just, in my notes here, it says it goes without speaking that there was also trauma in our community-based organizations that really did serve as frontline workers in a lot of spaces as well. Jeneba and Dr. Zendejas, could you speak to its impacts, but also the same question? So how do we start to build resilience in our nonprofit workforce by healing individuals from the trauma of the pandemic?
Listening, I echo what my fellow panelists have said. One of the things that the helping profession, we call it a helping profession, we tend to disregard our own needs and wants in order to help others. And what we've realized, especially in our organization, we were an organization that rarely had any turnover. And we were also impacted by turnover like any other profession during the last couple of years. And it really shifted something within me as a leader. And this is where I needed to check myself. The pandemic was an opportunity for leaders to check themselves, because I'm the type of person where I come more from a service perspective where I disregard my needs. And what I had to realize was I needed to listen to my staff and not just, like the emergency, the EAP plan, a wellness program, or just giving people days off. We had to really listen to what their experiences were. And the most impactful experience, what my team went through, was supporting our highest need families within the county. And these are people who are pretty isolated in some ways, or working 2 or 3 jobs, working in professions where they easily were getting COVID, and running all over the county, dropping off food because our families didn't have family support to help them if they got COVID. They were just stuck at home. So you have my team was literally running all over the county trying to support families as they were getting COVID, or translating some of the health officers' messages, calling families and translating them and holding space for them. I use the metaphor of an open, like a bowl, an empty bowl, where we're constantly asked to be an empty bowl. And the biggest lesson for me in all of that was to listen and to support and to basically do what my team was telling me to do and what they needed to feel supported. And again, some of that support was moving on. It's so interesting. We had some people move on, and then some people come back. They needed a break, they left, and then they came back. But this was a really good learning opportunity for most of us leaders, where we just had to listen and support. Yeah. Did we have any fun, Eric? I don't know if we had any fun. We try to have staff retreat and stuff like that. Yeah, Zoom fun. Lots of trivia via Zoom. Lots of gift cards, too. That's how we were bribing people.
I'm taking a lot of mental notes and thinking about what I need to do more of and what I can do more in the future. The last couple of years out in the rural area, it has been a real challenge for us, for our family. And I started off saying that our team is heroes because they are. In the rural communities, unincorporated areas of Yolo, our families needed us more than ever, and our team got us through. A great example is we partnered with our local school district, with the county, with the Yochidi Wintu Nation, and when kids were doing distance learning, at home or wherever in a safe place, hopefully, and behind that computer screen, in the rural community, they were doing their distance learning with us on site at the schools. And so every day, 7 a.m. to 6 p.m., Monday through Friday, our team came to provide a safe space for our young families to drop off their students, and they did their distance learning with us. And it was incredible to see that, right? You have these 5-year-old kindergartners for the very first time, and you have a group of them. We followed all the rules of the county. We made sure that everyone was safe, and it was just incredible to see these 5-year-olds in a classroom, all with their headphones and looking at a computer. And it was our team that stepped up to serve during that time. And it was our community of Yolo, our school districts, that allowed that funding to continue to be innovative and serve. So we did what we could during that time to listen and provide what our team needed. But really, our team just met the needs of our community. There was a single mother who was working out in the farms, because essential workers, right? They had to work. They had to work to survive, to continue feeding their families. And a single mother would drop off her 6-year-old son with us every morning, and just so thankful and grateful that we were there so that she can go to work. And I think that I don't know how we can ever repay our team during this time, but it's important not to forget, because I keep on like, what's next? We got to move forward, and to take that time to reflect and to breathe and to ask questions. I'm learning a lot from this, so I appreciate that, because we've been in go mode the last 2 years and continuing to do that. So taking that time to really reflect and appreciate. So thanks.
And you talked about children, so I was going to queue up this next question. So earlier this morning, we talked about children are uniquely vulnerable to the effects of overactive stress response because their brains and bodies are still developing. And this is going to put children at greater risk for heart disease, diabetes, premature death. So what steps can we take here in Yolo County to make our children, youth, and families stronger? And then are there any programs or initiatives that is really going to advance this work? And this could go to anyone. You've got the mic.
So, in the rural community, as Yolo County, born and raised here, growing up in Woodland, and it is different in the rural area, and we're so fortunate in that in Esparto there's 3 schools. So what we have done and what we're going to continue to do is provide a full-time mental health clinician at each of our school sites. Right now in Woodland, in Davis, in West Sac, it's a lot harder, right? Because there's a lot more schools. But at least in the rural area, we have partnered with our school districts, with our county office of education, with the Yochirihi Wintu Nation to make sure that every school site in the rural area has a full-time on-site clinician. And so we've been able to get creative and partner to be able to provide that and provide mentorship and opportunities and supports where we focus on the strengths of our young people and of our team to provide as many opportunities for our rural residents as possible. So we're extremely fortunate in that fact, and it's the K-12 partnership, the work that the county is doing with YCOE and local providers to try and increase mental health services at our school sites in Woodland, in Davis, in West Sac. You know, we're working towards that and continuing those partnerships to make sure that our young people do have access to those services, that they need it immediately and they know how to access it, and families feel safe in asking for that help. So yeah, I'm really looking forward to continuing those efforts in any way that we can here in the larger cities.
So for us, we work throughout the county in our home visitation program, and that program has recently been expanded. Welcome Baby. This is a partnership between our organization, Community Care Health Centers, and First 5 Yolo. So basically, is the continuum of home visitation. You start with Welcome Baby, and this is for our low-income families. And then after working with mom or caregiver in Welcome Baby, if they need further home visitation, they then triage into a comprehensive home visitation program, which we as an organization facilitate throughout the county. There are other programs that we're working on as well. We're in partnership with the county in the YOBI program, which is universal, well, I shouldn't use the universal word. It is a poverty reduction program. So I see this from inequality perspective. Children are experiencing toxic stress because their environments are stressful. Their parents are also experiencing toxic stress. And as an organization, we take a child-centered approach. So whatever affects the child, those are the issues that we work on. I recently went on a rant that First 5, as an organization, needs to get involved in the housing space. Affordable housing is affecting our 0 to 5 population, not only our older children. Homelessness is affecting our 0 to 5 population. We recently had a family who was renting living room space out of a friend's house with 2 babies. Worked with that family to get them into housing. So having these programs, poverty reduction programs, where you're actually helping families cross that threshold of the income, the cost of living, income, everything that has to do with living in California is what would support children. Stabilizing their home environment with not only parent education, but basic resources, making sure that they have somewhere to live, affordable housing. That's what's going to stabilize families. And as our income, as our cost of living in California continue to increase, and you have companies, I'm just gonna call it out, like Walmart, who employs a lot of our families in West Sacramento at a half-time basis where they're not required to pay for health insurance or anything like that. If you have companies like that and are not being held accountable, then we will continue to have children growing up in poverty. And as a society, as a county, what do we do to address that? Let's look at poverty. Poverty is the real issue. So how are we as a county going to come together to address poverty? And I'm so encouraged by seeing some of the investments that's happened over the past 2 years in this space, where we now have YOBI, we have Welcome Baby, we have mental health services at school sites. We have all this collaboration going on. But one thing that I was ranting about the other day, I do a lot of rants, I've realized, is that we're not incorporating the business space, the business sector into this work. It's all of our responsibility. So if companies like Walmart are not being held accountable, maybe that's why they can't find people to work for them. So, gosh, did I answer that?
You did a great job. I'll start, and then you're welcome to still keep addressing this question, but to Dr. Sisson, Dr. Sens. So in going back and looking over some of the research, some of the evidence-based practices to regulate stress response were some pretty easy accomplishable things: balanced nutrition, regular exercise, quality sleep, supportive relationships. So how can the medical profession address good practices in our community, and how can we scale up these projects to really help serve, our community and our families?
So my specialty in medicine is general preventive medicine and public health. And one of the first things you learn in preventive medicine is that your patient is not an individual, but it's an entire population. But of course, a population is made up of individuals. But I think this is a perfect question for someone in preventive medicine, because it's about how do we take something that we know works at the individual level, but scale it up so that it's available for the entire population. And it's really about how we design and build our communities and creating environments, as Jeneba talked about, where the healthy choice is the easy choice. So if we look at health, only about 10% of health it happens at the doctor's office, and about 60% of health is determined by our behaviors, and our behaviors are in turn affected by our environment. So if we can create environments where the healthy choice is the easy choice, then we can build physical activity into our lives just by having walkable, bikeable communities with ready access to public transits. We can have affordable access to healthy food to improve the quality of our diet by having farmers markets and other community farm stands, such as the one that I had at my farm in West Sacramento. So I think those are the types of interventions that we need to have that are really looking at much bigger than the healthcare system and providers. No offense to the important role that our providers play, but we really all play a role in something called health in all policies, where all of us who are involved in making policy decisions can be thinking about health. So people in the transportation agency, for example, may not think about the work they do as impacting health, but where they put roads and whether those roads have sidewalks and bike lanes does impact health. And so we need transportation folks to be thinking about health, or we need health folks at the table when transportation decisions are being made. So I think that's how we scale up these individual level interventions that we know work about nutrition and physical activity to make the healthy choice the easy choice.
Absolutely, 100% agree. And I wanted to call out the kids farmers market at the school program, which is just so critically important. And I, in addition to the availability of these fresh fruits and vegetables, which we know have become so expensive. I mean, it is cheaper to feed your family at McDonald's than it is at the grocery store, especially when you're buying produce. The other thing that I have seen firsthand as a pediatrician, and that I hear from my colleagues as well, is that one of the effects of generational poverty has been a loss of family culture knowledge around not just I don't have enough money to buy broccoli, but I don't even know how to cook it, right? Because when I was a kid, I didn't eat it. My parents didn't cook it because it was too expensive. So I learned very quickly as a practicing pediatrician that if I'm going to sit across from a family and say you need to do a better job of feeding your child, right? But am I addressing the cost of that food? Am I addressing the fact that they never had the opportunity to learn how to cook it? And I think that's where the community comes in, right? We need to step into that gap. We need to make those items available. And then I know that one of the programs with the school system actually provides recipes. Just more of that, more and more and more of that.
And looking at it, one of the things that we did by intentionally bringing a group like this with diverse backgrounds and experience together is because we really didn't believe that the solution lies in one field or one area. And as a group, as we talked before the discussion, we agreed that this work is really best done without silos. But to ask the panel, from your perspective and lens, what silos still exist in our community that we need to address or that need to be broken down to really move forward with this work?
Well, I will jump on this one quickly because this is a passion item for me. And I will say that this is not unique to Yolo County, but it is somewhat unique to California, and that is this very damaging silo that separates out mental health benefits from your medical benefits. And I would love to see us come together, agencies, to lobby to change this, because it really takes our patients and it divides them in half. And we know that our patients are whole people and that their mental health and their physical health are highly integrated. But as a physician, to have to tell your patients that, I can refer you, but your behavioral health benefits are separate from the benefits you have with me, and then I can't really help them navigate that. It's infuriating. And it stigmatizes mental health, right? Because it makes it something different than what I'm doing. And I could talk about this all day long, but anybody who wants to help me at the state capitol and try to change this, come with me.
So I also serve as the chair of the Yolo County COC, which is the continuum of care for our housing and homelessness system. Every county is required to have this per HUD mandate, but HUD does not provide the capacity building for it. Again, you're tasked with doing something, but the federal government or the state government does not provide the resources for it. Deanna's back there. She's on my board. So the gap that I see is affordable housing. We're in a crisis right now. Most people, especially people of color, cannot afford to buy a home or even potentially rent. I'm even thinking about students. When you graduate from college, our educational system in the United States is very expensive, especially university and colleges. It's very expensive, and there's just not enough housing to go around for everyone. So we need to collectively work in this space because the lack of housing, especially affordable housing, is causing toxic stress in communities. Our homeless population is going to continue to increase if we don't pay attention to the lack of affordable housing. And the people who are missing in this space, I wish we had someone represented from the Realtors Association in that space. At my core, I always describe myself as a hippie and a yogi. And I really think that the rental market and just the housing market in general is very much driven by greed. And if they don't realize that they're creating a real issue in society right now, I don't know where we're gonna go. Just working on this issue for many, many years, it feels like you're swimming upstream. I feel like I'm being a little depressing right now. But it is a real issue. I am sounding the alarm that please stay engaged in conversations about homelessness and housing. If you live in Yolo County, the government cannot do anything. I'm saying that for Aimee because she's right here. I live in Sacramento, and I'm privileged to work in this county because I see how much collaboration is happening, not just with the county and the cities, but also the COC and the cities and all the nonprofit organizations, faith-based organizations. We're all trying to work on this issue. It's a large issue. So if you have any influence or you can contribute to anything, please contribute your voices in that space.
I don't have much to add, except that I completely agree with Ashley. We did not coordinate our responses, but I'm looking at my notes, for where the silos are, and it's that mental health is treated separately from physical health, and they really need to be seen as intimately connected. And I know in my own experience, several years ago when I was dealing with anxiety and depression, they manifested as physical symptoms, and so we have mental health challenges that impact our physical health and physical health challenges that impact our mental health. We should just be thinking about our health, and we shouldn't have to specify mental health or physical health. It's just health, and our funding and our insurance needs to think that way too. So I'll go with you in lobby.
That's a Tico.
Oh, go to the next question.
I was looking at the time as well. So we're at the 7-minute mark, but I think we're comfortable. We kind of looked, I was reading the question that I kind of left at the end there, and it's very overarching and very large. But in terms of just a closing thought of where we go next in Yolo County, and I think in part of that was just what's going to make us stronger. So, do you have a big idea? Do you have a thought about what's next for Yolo County? Where would you like to see us go? What would you like to see this group go out and do?
Thank you. So building off of these types of events is definitely a start. It's a good place. YOLO is a great place to live. About 240,000 residents. Like, we're small enough, but we're big enough. It's a great place to be able to collaborate and actually get things done, right? If there's a need, if there's an idea, right, we should be able to know how to access that and have contact with those individuals that have a seat at the table, elected officials. So I would say I would love to see us increase our civic engagement so that we understand local government and allocation of resources and know how to get in contact with our local officials, right? Everyone should know their school board, their city council, their county board of supervisors, right, at minimum. And there's a lot of great things happening. The YOLO Youth Conference that just happened last week, right, a couple weeks ago, that is working on those things. So I would say continuing civic engagement and collaboration. We're a small county. Everyone has a voice. Every single one of us has a voice. So making sure that people know how to express that voice, and we give that forum. Focusing on our youth, 100%, focusing on the strengths and our talents. And again, all of these things are in place. Growing up in Woodland, Yolo County my entire life, we weren't having these intentional system-wide conversations 20, 30 years ago, and we're doing them now, so that's very encouraging. It's exciting for the future. So continuing this and the momentum taking forward, and get involved and ask questions and bring ideas, and let's work together.
Thank you for that. I'm going to heed the call. I think one of the things, I know it's too early, it's certainly too early for me to really be in a space where I can think about silver linings from the pandemic, but I try to make myself kind of go there sometimes. And I want to call out that one of the things that I think we all saw were our collective ability to break down barriers to make things happen that needed to happen right away, right? So the ability to pivot. And so, I think about and I'm so glad that I'm here, and I'm so thankful for the invitation to really have an opportunity to focus on resilience. And what I was thinking about before coming here is that us as individuals, when we have individual resilience, we bring that resiliency to our organizations, right? And that's what allows us to pivot so quickly, and it's what allowed us to pivot in the pandemic. And I'll just give one example. There was when the vaccine came out, our schools were closed, and we were able, with Dignity and Woodland Healthcare, to be able to provide the COVID vaccine for the teachers in Yolo County. And we were able to do that with a speed that we never would have been able to do before because of red tape and bureaucracy. And we would have had meetings about meetings, right, to be able to make this happen, right? And I don't want to go back. I don't want to go back to that. So I think my thinking is that all these agencies that are here today, let's keep that culture of being able to pivot and get things done.
Yeah. Here. I think did my call of action earlier in regard to the affordable housing and homelessness space. One thing that I'll like to comment on, my last comment would be, don't stop fighting for what you're passionate about. Complacency is real. We went through this pandemic, we all learned a lot of lessons. We need to take that spirit and keep moving forward and keep collaborating. Do not stop fighting for what you're passionate about. When I came in earlier, I met Susan in person for the first time. We've been collaborating throughout the pandemic, but met her in person for the first time. And Tessa, I've known for years, but just being with these two powerful, collaborative, and just passionate women who have pretty much set the stage for young leaders like me to do this work and continue this work. It was a very powerful moment. Shout out to women. Women are very resilient. We're going through a lot right now, dramatically. I'm not gonna talk politics, but we are going through a lot right now. But just seeing Susan and Tessa and just saying thank you for everything that you've done and continue to do to set the stage so that I can do the work that I do. So don't stop fighting for what you believe in.
You know, when we talk about resilience, we often talk about bouncing back, but as Ashley just said, we don't want to go back to the way things were before COVID. And so I mentioned this earlier, but this concept of bouncing forward or post-traumatic growth, we don't want to go back to the status quo. We want to end up in a better place than when we started. And when I think about post-traumatic growth, there's 5 forms in which that takes: finding personal strength, gaining appreciation, having deeper relationships, discovering more meaning in life, and seeing new possibilities. And of those 5, the one that really stands out for me is deeper relationships. And that's what I think for me, coming out of this pandemic, it's about the relationships and the partnerships that we formed and strengthened and how we use those to move forward. So as I look around this room today and I see so many folks on this panel and in the audience who, as the health officer, I've collaborated with over the course of the pandemic, and we're going to take those relationships and build on them to do more and better work after COVID. And so I think for me, the relationships that we've formed, we will continue to leverage and build coming out of this pandemic stronger.
Well, with that, I'm going to officially call an end. I would love to just have you join me in thanking our 4 panelists for joining us today. And again, just from us as a group too, thank you again for all your leadership, for the work that you're doing. It is very well and deeply appreciated from all of us to you as well. So thank you again for joining us.